Dr. Perez Mitchell is with us now. He's with the Memorial Healthcare System, and he's going to be talking about robotics in head and neck surgery. But first, I'm going to learn a little bit about his history. Thank you so much for joining us, and thank you for being in the Cayman Islands.
Oh, thank you for having me here. It's a pleasure.
So I must be honest, I read your bio, and you have an interesting story. How did you decide to become a doctor? Why was that important to you?
Well, I think one of the main reasons in my life that made me think about the career of medicine was sickness of my father who passed away. I noticed and I realized that medicine, and specifically the medical doctor, is extremely important in the worst or the lowest, if you may, part of a family who's losing a loved one. And I wanted to make sure that I was able to take care of not only of my family, but specifically of people that are having cancer. And that's basically the reason why I came into medicine.
And so you got into the surgical side of things, but then decided to specialize in cancer. How did your experiences impact your approach with your patients?
That's a great question. You know, ENT is a very broad specialty, has to do with diseases of the ear, nose, and throat. Most people know it as otolaryngology, basically. So we deal with head and neck diseases. Specifically, I deal with cancers of the throat area, the tongue area, neck area. I'm originally from Puerto Rico, also an island on the Caribbean. And at the time, there was a dire need for those services which were not available on the island. I'm sure, you know, it probably happens here on the Cayman Islands, where sometimes you need to fly abroad for services that are extremely specialized. So I had to fly out from Puerto Rico to the mainland U.S. to do my training, specifically in cancers of the head and neck, in order to be able to help my people. Basically, that's what it was.
A lot of what some of the feedback has been from your patients is that you treat them like family. Did your experiences with your father really make you think about the way you connect with your patients?
Absolutely, absolutely. I had two experiences with my father and my fiance. My fiance passed away of brain cancer, so definitely God had a plan for me, and I think that I listened well. I think my God-given talent to be able to operate on cancers of the head and neck, I definitely have a calling for it. And I think that for me, the battle against cancer, and I always say this, is it's personal.
Are we making progress then, do you think?
Absolutely, absolutely. Cancers of the head and neck used to be very mutilating, meaning that it affects areas like the swallowing, speech, breathing. A lot of patients wind up with tracheostomies, which are tubes that we put on the neck for breathing. And advances have been so good that now we're able to do major surgeries or remove cancers of hard-to-reach areas without having to affect those regions. So quality of life definitely has been improved.
Now, tell me, how is robotics changing this? What is the specific role that robotic surgery is making a difference?
So in order, you can imagine a cancer of the throat, which is what we see most commonly now, and I may add, if you allow me, that throat cancers that are related to the human papilloma virus are actually the most common cancers related to that virus that used to be cervical cancer. So about a month ago, a paper came out stating that has surpassed throat cancers related to this virus, has surpassed cervical cancer. So that means that we're seeing an increase in the incidence of this cancer. We needed to make sure we have ways and means to try to minimize the morbidity entailed by the treatment. So that's how robotic surgery came about. You can imagine that the surgeon's hands do not fit through the mouth into the throat. So we started using the robotic system. It's called Da Vinci system, which is also used in urology, so using gynecology surgery. So now we can access We have access through the mouth into the throat without having to do major splitting of the jaw or major splitting of the neck. Way faster, recovery times are way faster. Patients stay in the hospital 3 days instead of 7 to 10 days. Patients can go home with oral feeds. They used to go home with gastrostomy tubes for feeds, and they also needed tracheostomies for breathing. Now you don't need tracheostomies. So it definitely has allowed us to be less traumatic, if you may, with the treatment, without compromising the oncological outcomes, which at the end of the day, that's what we're looking for.
That's what you're trying to do,
yeah.
right. So that's really interesting what you were saying about the HPV virus and the throat cancer, because when you think about it, I mean, most women go for regular gynecological screenings. Is anybody screening for this, or how do we?
The sad part is that we do not have a screening tool for cancers of the throat. We have it for colon, we do colonoscopies, prostate exams, mammography for breast. So I always liked, in these forums, I always like to enforce the fact that the only way we can screen is to be aware of the early signs of the disease. So I always like to say that we have to look for things like a aphthous ulcer of the tongue that doesn't heal in 2 weeks, any throat pain that doesn't get better in 2 weeks, or any hoarseness that doesn't improve in 2 weeks that needs someone to take a look at. Would it be a specialist? Would it be your primary doctor? But someone needs to take a closer look at what's going on. That's really what we have right now.
So it's just don't ignore those warning signs.
Correct. I also want to add that the vaccine for the HPV, it's out. The age has increased to 45 years old. The age used to be only to like 21 years old.
Oh, that's interesting.
I want to say maybe about 3 months ago, it increased so we can vaccinate. The FDA approved it for vaccination up to 45 years old. So that's something extremely important for people to know as well, because it could definitely be protective.
And that's for men and women?
Men and women.
Okay.
Human papillomavirus is the most common sexually transmitted disease in the world. Estimates show that about 80% of the US population is infected with the virus. Most patients are asymptomatic, because even if you get infected, the body has a way to get rid of it most of the time. The problem we're having is that there's about 100 strains or more of the virus, and specifically number 16 is the one that's causing throat cancers. So again, I think the prevention, vaccination is extremely important. I think it's a hot topic, and I think a lot of people are afraid of vaccinating their children, but I see these cancers every week, correct? So yes, and I really think that everyone should be getting this vaccine. I really recommend it.
Okay. Dr. Perez Mitchell, thank you so much for sharing this information with us and for sharing the good news with what you're able to do with robotics now.
Thank you. I appreciate it.
Thank you.